So my name is Joe Wu. I'm the director for the Stanford Cardiovascular Institute, and I want to thank all of you really for taking time from your busy schedule to come here. And I also want to thank the organizers for setting up this very, very wonderful program. So why are we all here, and why are we having set up this conference on cardiovascular health in women? Well, I think some of you may not know, cardiovascular disease is actually the #1 killer for women. Cardiovascular disease kills more women than men. All right, so let me just repeat that. Cardiovascular disease kills more women than men. And in fact, cardiovascular disease kills 1 out of 3 every woman, compared to breast cancer, which kills 1 out of every 30 women. So most people don't know the statistics that way. And because of that, the AHA, the American Heart Association, has a mandate that by 2020, they would like to reduce the cardiovascular mortality and morbidity by about 20%. In parallel, the NIH, or the National Institute of Health, has recognized the importance of cardiovascular disease in women, so that a lot of their research programs actually mandate that there's an equal portion in terms of studying female sex. So for example, in the old days, when we applied for grants, we would propose that we want to do 100 rats, and we would put down that these are all male rats, and that was okay. But right now, when you think about it, does it make much sense to study all the drugs and all the disease mechanisms all on male rats or male mice or even male subjects? And this is the reason why the NIH recognized the importance of that, because the way females and males respond to drugs, the way females and males have different cardiovascular events are quite different. So starting past a few years, the NIH has actually mandated that all the studies need to have a female sex component, either animals or human subjects. So you'll see in the next 3 to 4 hours how our Stanford cardiovascular investigators are working on these issues. And you'll hear a whole bunch of presentations that, in my opinion, cuts across all disciplines from basic to translational as well as to clinical research. You'll hear disciplines from medicine, from immunology, from engineering, and a whole bunch of other research focus. I also want to give you a little bit introduction about the Stanford Cardiovascular Institute. The Cardiovascular Institute was set up around 2004, and right now it has about 110 members or faculties, and all of us study different disciplines, including women's health. There's also a big focus on studying precision medicine or precision cardiovascular medicine in women's health. For example, in my lab, as well as several other labs, we're taking essentially skin biopsies from patients, and for the skin biopsies, we turn them into your beating heart cells. And for your beating heart cells, we expose your beating heart cells to drugs and see how your beating heart cells respond to these drugs between men versus women. Right? In the past, that's never been possible, right? But right now, it's very routine at Stanford to do that type of study. And in fact, if you're interested in that kind of research, there's actually going to be another symposium sponsored by the Cardiovascular Institute on March 29th at the same place here. It's on drug discovery, and a big component of that will be focused on regulations and policies, including how that applies to the female sex as well. And so, I just want to thank all of you for coming here and for being active, engaged participant in this particular disease topic. And I would urge all of you to be involved, to either work with Stanford investigators, to be community volunteers, or to reach out to any one of us for this topic. And with that, I want to introduce our co-organizer, Dr. Marcia Stefanik. Marcia is a professor at Stanford University. She's also the director for the Women's Sex Difference in Medicine program. Marcia is, in my opinion, one of the top 5 leaders in the country in this particular topic. She was the PI, the principal investigators of the Women's Health Initiative, which is one of the largest programs sponsored by the NIH to study this particular area. And Marcia, we're very fortunate to have Marcia as one of our faculty members, and Marcia will kick off the program. Thank you very much.
Thank you for those kind words. So welcome to the Wisdom Cardiovascular Institute Women's Heart Health Symposium on Sex Differences, Basic and Translational Research Symposium on Sex Differences. And what I want to do is, first of all, give you a little bit of information about the Wisdom Center. So the Wisdom Center, I'm the director, and Sonu Thadani, who I don't know if she's in the room now, was outside as our managing director, and T.O. Pricing, who you saw at the desk, is there too. Our vision for the center is healthy women and men from conception through the life course. And so we really are working from some of the issues in cardiovascular medicine that relate to pregnancy, preeclampsia, issues like that we've just put in a huge grant to try and study, all the way through the life course. So a lot of my research has been in menopause and older women. And our mission is advancing human health across the lifespan through research and education in women's health, biology of sex differences, and gender medicine, which is really the issue of recognizing that women are different from men when they are, and recognizing that you need to treat women if they are the same or different from men in different ways if it's appropriate. Cardiovascular disease has actually been one of the leaders in recognizing the huge sex differences on heart failure, in blood pressure, in all kinds of other areas that you'll be hearing about today. So just so you know, our Basic and Translational Symposium series has been going on since 2010. The very first one that we did, we had all of the institutes of medicine involved. The Stanford Cardiovascular Institute was really one of the leaders. We worked on this together. And then we had another one in February 2012 that really focused on heart failure, which has a lot of sex differences. Again, this one was actually run by the Stanford Cardiovascular Institute. In 2013, the Wisdom Center put on a sex difference conference that was focusing on neurosciences, which is really complex because you're talking about neurobiology, psychology, psychiatry, neurology. They're all different areas, and they all come at it from a very different approach. In 2014, we partnered with the Institute for Immunity, Transplantation, and Infection on sex differences in immunology, which are huge and probably underlie a lot of the sex differences in cardiovascular medicine as well. And then last year we did cancer in partnership with the Stanford Cancer Institute, which has really taken sex differences on as one of their primary directions that they're going into. So if you're not aware, there's major sex differences in liver cancer and thyroid cancer, in lung cancer and many other cancers. But it's great to be here today, coming back around with the Cardiovascular Institute and partnering with Women's Heart Health at Stanford, which I actually helped found, so I was very proud that this has continued. If you didn't know, last year, in partnership with Women's Heart Health at Stanford, the Wisdom Center hosted the National Organization of the Study of Sex Differences here. So we had every room in Berg Hall filled with people who are doing this research in every discipline that you can imagine. And you should know that we have seed grants, and these seed grant workshops, we really try and educate the Stanford community on the issues of sex differences. I'll tell you a little bit more about that in the next slide, but I do want you to know that 3 of the awardees of our seed grants are presenting today. And so you're going to be hearing from Mintu Tarakia, Patricia Nguyen, and William Fearon. But in addition, the other speakers on the program got seed grants from Women's Heart Health. So this is really something where we've gotten special funds to fund everybody who's speaking today on this topic. And so we really went to special efforts to do that. And I'll mention the others in a moment. Just so you know, we also have the Wisdom Center has an annual Women's Health Forum. This year we're actually going to do it in partnership with the Dean's Health Matters program, and we're going to be focusing on a symposium that's Why Sex and Gender Matter in Precision Health for Women. So that's May 4th, and it's on a Saturday, and that one is really a community event. So I mentioned the seed grants. I just want you to know that there's been a lot of activity at the NIH with respect to funding and to be looking at sex differences. In our 2014 workshop, which is the one that was resulted in 3 of our speakers today getting seed grants, we really honed in on cells and animals and the fact that the NIH was already announcing that they really were expecting people to balance their studies and have both male and female animals in their studies. We actually got some great talks from the Cheryl Green, who's the chair and professor of comparative medicine, on the veterinary services and how animals are housed here. The fact that male and female animals are housed differently is something that needs to be taken into account. And then from that, we actually had a workshop with the Gendered Innovations Group at Stanford, and we created an opinion piece that got published in PNAS, and I meant to bring them today, but I didn't do that. This year, we really homed in on the fact that the NIH announced the expectation that scientists account for the possible role of sex as a biological variable in all vertebrate animal and human studies. And it's actually the case that starting January this year, you were absolutely expected to include both males and females in your research grants. And you should also know that there's a huge activity to try and get sex and gender in the medical education. And so there was a big conference at the Mayo Clinic that I attended where we had people from dean's offices across the entire country looking at this issue. So it really is a very hot topic. The NIH actually has a special training program, an online course that you can go to get this information and actually become a certified sex and gender researcher and educator, and so this is something that we really are trying to promote here at Stanford. I will tell you, I teach a lot of classes, and we've put together a lot of classes that go into every aspect of the sex and gender arena. We have a special application for medical students who want to go into women's health and sex gender differences. We are looking at every issue. We are working with the Dean's Diversity Cabinet on not just women, but LGBT, QIAA, and there's lots of other alphabets there, all of which are important for diversity. And also there's a working group now that's really looking at overhauling the medical curriculum to really bring this in. So there's a lot going on in this space, and with that I'm really proud that we have this event. Unfortunately, Jennifer Tremmel couldn't be here for this particular opening. She will be back at the beginning of the second session to present on her very interesting research on non-obstructive coronary disease and sex differences in that regard. But with that, I can tell you that 3 of the speakers who are on the program today got Special C grants from the Women's Heart Health Center, and that was Philip Yang, Sean Wu, and Ewan Ashley, who isn't speaking today, but Matthew Wheeler will speak on the research that he's been funded to do. So with that, I'm just going to go ahead and pass this over to our first speaker, who is Philip Yang, and he has to catch an airplane, so he's going to be, we basically got Joe in, and we're getting Phil out just in time. And his talk, we can bring that on up, is Male versus Female Human Fetal Amniotic Mesenchymal Stem Cells, Immunoprivilege, Cardiac Differentiation, and Regenerative Capability, and just to let you see how incredible this topic is. Oh, I guess, should I do?